Good morning, viewers. This is Dr. Praveen again. So we are into our second set of series for the topic for the heart and its problems. So today we are going to discuss about what are the symptoms associated with the heart disease. Okay, heart disease can present with myriad of symptoms. Symptoms can be there as a child, as when you're growing as an adolescent, as an adult, as a middle-aged individual, and as an elderly individual. So we need to understand that the heart starts functioning in the mother's womb from the almost like when the baby is forming in the mother's womb. The heart starts to function as well. So basically, there is a huge remodeling happening in the mother's womb in terms of being from a single tube to a double tube chamber to a four-chambered heart. So the heart starts functioning within the mother's womb, and then it can rest only at the time of death. So there's a long time that the heart has to endure all the pressures, all the volumes. So it's an organ in the body which never gets rest. So right from its inception to the end, until the last breath, the heart has to work. So basically, when we are talking of heart diseases can happen in children. As a result of malformations within the mother's womb, then the heart can have problems while the child is growing, and when the individual becomes adolescents or adults, and then they move on to have heart disease as a old age people as well. So when it comes to the childhood, so we tend to see lots of congenital heart disease where we discuss about holes. The valves will be non-development, one half of the heart is non-developed, or the valves are pretty tight, or the valves are leaky, or there is a hole in the upper chambers, or there is in the lower chambers, or there is an odd connection between the great arteries. So there can be multiple anomalies and multiple malformations happening as part of the developmental malformation happening in the mother's womb. So we classify them as congenital heart diseases because they are at birth, they are visible. And the child presents with multiple features. Children who have very tight valves, blood not flowing into from the right side of the heart to the lungs, they have breathlessness, they have bluish discoloration because there is not enough amount of oxygenation happening in the lung level, or enough amount of oxygenated blood not coming into the left side of the heart. So the babies tend to be blue. Apart from this, there are holes in the heart which can happen in the upper chambers and the lower chambers, which are called the atria and the ventricles. So similarly, you call them as the atrial septal defect or the ventricular septal defect. So the holes in the upper chamber are usually low pressure holes because the chambers are low pressure chambers. Henceforth, the problems are usually not catastrophic, and the babies are born reasonably healthy, and they can be identified as they are growing as a result of increased breathlessness or palpitations. So, which can be diagnosed at birth through a echocardiography, or even in the mother's womb, they can be picked up as a fetal echocardiography, where we can identify the holes in the upper chambers or in the lower chambers. Holes in the lower chambers tend to be a bit more sort of an emergency situations. Once the baby is born, they can be identified with a murmur on the chest wall, and then basically it can be diagnosed with the echocardiogram, and probably necessary surgical procedures or percussion procedures can be done to close these holes. Some children tend to have a non-developed left heart, which is called as hypoplastic left heart, and usually they are life-threatening and they don't make a meaningful life. So these extreme abnormalities or malformations are detected in the fetal echoes, and probably the couple can be advised with regards to discontinuation of the pregnancy because these children don't make a meaningful life post-birth.